Yeah. Good.
Hi, everybody. So we're going to get started. Welcome. For those of you who do not know me, I am Michael Remaley. I run the public policy programs here at Philanthropy, New York. And I have really been pushing hard this living wage issue with our public policy committee. And so I'm really into it. And I was really into the previous discussion we had here at Philanthropy, New York that was really initiated by the New York Community Trust and Jennifer Jones-Austin and Jim Parrott about the work that they're doing. So that conversation was very good and important and thoughtful and raised lots of good questions that I think that we wanted to try to take up today about what are the barriers and the various options of pursuing this living wage issue, both for nonprofits and possibly for all sectors. So, but we're really focused on nonprofits and philanthropy's role in making a living wage happen. So let me just say a little bit about what we're doing here. So the reason why we have mics here is not for amplification in the room. We are live streaming this, so it gets picked up to our live stream audience. And so when we do get to Q&A portion of our session, please let us give you a mic to talk into so that the people, the 1 million people that we have following us today, that however many people who are out there following us online can hear you. So welcome again. And let me just say a little bit about the structure of our conversation. There will be about half of our time today will be spent in complete, open conversation amongst those of us who are here. Hi, Lisa. But there is a little bit of, we're going to give background. The wonderful panelists here will give background on what we're doing. And the order we're going to go in is we're going to start with our esteemed leaders who were here before to give a recap of a little bit of what they talked about last time. So that's Jennifer Jones-Austin from the Federation of Protestant Welfare Associate Agencies, and Jim Parrott, who is with the Fiscal Policy Institute. They'll say a little bit about their initiative and what they're doing and kind of recap the previous conversation. Then we're going to spend a very good amount of time with Carol Kellerman, who is new to us here, and we're going to hear her for the first time here at Philanthropy New York. Is this your first time? No. First time here on this topic. Sorry. On this topic. And she's going to give us like some really good grounding in the numbers and the real challenges. And then Allison is going to serve as, I think, the conscience of the nonprofit community and talk about, just kind of give a recap of what has been said from her perspective and keep us all in check. So, easy roll. So my panelists have asked me to ask you to introduce yourself. So I'm going to start with Tiffany, and we'll go around the room and say who we are and what organization we're with.
Hi, I'm Michael Hinderberg with JP Morgan Chase. Right, Allison, consultant for workforce.
Hi, I'm Fiscal. I work at the office of Philanthropy and also the chair of
Michael with Arts Foundation. Tom Nichols, the Arts Foundation.
Judy Bigelow, Board of Street Foundation. Emily Miles at CWA.
James Parrott, Fiscal Policy Institute.
Jennifer Jones-Austin, Federation of Protestant Welfare Agencies.
Carol Kellerman, Citizens Budget Commission.
And Allison Sesso from the Services Council.
Awesome. Thank you. So, as promised, we're going to lead off. I'm going to hand it over to James, and he's
Who's going to hand it to Jennifer to start?
See, I'm a horrible, horrible moderator. I should just, my job should be taken away from me.
The coordination is
Yes,
good.
I can't even read my own notes. Jennifer, please.
Good deal. So good afternoon, everyone. And good afternoon, all those out there in the stream land. I'm really, really pleased that Philanthropy New York decided to have this briefing. As you mentioned, it's the second part of a conversation about living wages for low-income social service workers. FPWA and FPI, several months ago, I can't even remember how long ago now, it seems like we've just been partnering for a while on this, but several months ago we came together appreciating that there is a body of people here in our city who daily are working to help meet the needs of those who have been deemed most vulnerable, who themselves are vulnerable. We're talking about social service workers in contracted agencies that are providing social services through government contracts with the city and who are earning a wage that does not allow them to meet their basic needs and take care of their families. We're talking about 25% of people in these agencies that are making less than $10 an hour, and we're talking about 40% making less than $12 an hour. They look mostly like me, women of color with children, and they, on a daily basis, are struggling like the people that they're there to serve. When we began to learn more about these issues, we grew to appreciate that now is the time. If there ever was a right time to really focus on this issue, it is now. Here in New York City, we have a city leadership in place that is very much concerned about wages and ensuring that people here in this city have equal opportunity and have equity. And so what we begin to appreciate is that as the city and others in the state, the governor, talk about a living wage, we didn't want to leave the nonprofit community out. And what has happened in some communities like Seattle, as an example, living wages may be increased, but sometimes the government doesn't come through and provide the extra funding for the contracts. So, contract agencies, while they get a leg up, if you will, they have to take 2 steps back because they still don't have the funding to provide the living wage. And often what happens is services may be cut, staff are stretched too thin. We don't need that to happen here in New York City. As many of you around the table well know, in the past, when there have been executive orders sometimes increasing wages for contracts, not-for-profit employees and agencies have been exempt. We can't allow this to happen. We have in Mayor de Blasio, we have in the city council leadership, people who are very sincere about this issue. And we've had conversations that tell us they're sincere and they're concerned about this as well. So we came together deciding that this is a time when we need to press on this issue. We need to press for living wages for social service employees working in contracted agencies. And additionally, we need to press for a career ladder for them. We don't want people to earn a more fair wage, if you will, but then be stuck and not be able to advance. And so what we see very often happening in the nonprofit agencies is that people have entry-level jobs, but they really can't move beyond that. And what we're aiming to do is twofold: to address the living wage, but also to address the professional development track or the lack thereof. What I'm going to do right now is turn the conversation over to James, who will walk us through some of the more specifics of our initiative, and then I'll say some more, and then we'll turn it over to the next comments.
Thanks, Jennifer. Thank you all for coming. Thanks for organizing this, Michael, Lana, Adia, others at Philanthropy New York. We think this is an issue whose time has come. We're talking about a sizable workforce that's providing invaluable city services, effectively an indirect city workforce, which for decades has not been recognized as such. And that situation needs to be rectified. This comes in the context of a period when there's a lot of concern about inadequate wages at a lot of levels in all parts of the country and a lot of sectors. And this is at the intersection of a lot of that. And given a new administration in City Hall, which is obviously very committed to trying to address these disparate wage issues and the broader dynamic of income inequality, we feel that this is an opportune moment to make some headway on this. What I'd like to do is to give you an idea of some of the background numbers that we're looking at. We're in a sense still at an early stage in figuring out how to do this, but we think we have a good set of numbers that capture that help define what the problem is in terms of figuring out the numbers that we need to understand and address to figure out how to get to the solution. We're starting to work on that. So the city contracts out about $5 billion in social services annually. So, that's in a $75 billion budget overall. So it's not a huge number by itself, but if you think in terms of the services that the city provides to low-income communities, this is the main way in which the city provides those services. In the wake of the recession in recent years, the inflation-adjusted city funding levels for this constellation of social service areas has took a real hit from 2008 to 2013, declining by roughly 10%. At a time when hardships were multiplying rapidly, unemployment was rising. We've been in a recovery mode for the last few years, and that so we're going in the right direction. But it's been hasn't been strong enough to really lift family incomes and wages for most workers. So the hardships continue and have lingered longer than in most previous recovery periods. This is a vast area, $5 billion in contracts, 5,200 individual contracts, mainly through the 6 major agencies listed here, spanning a range from children's services to homeless, to aging services, youth, health and mental health, and so on. Just to give you an idea of the breadth of this, we've listed 4 of the 16 object code areas. This is budget speak for a particular budget area. So as you can see in child care, there are 729 contracts totaling $780 million, and homeless family services as distinct from homeless individual services, which is a separate category, 391 contracts, $475 million. So lots of contracts going to lots of agencies, again, that reflect the broad diversity and complexity of the nonprofit sector. Some of these contracts go to agencies, to organizations that might have 1 or 2 contracts. Some go to larger organizations like SEO, which may have literally hundreds of contracts, providing services across the whole spectrum of agencies listed here, across the 5 boroughs of New York City. So it's a complicated universe to get a handle on. As we've been saying, this is really the indirect workforce for the city. The city has about 300,000 workers on its direct payroll, who are clearly understood as city workers. But this sector represents roughly a third that size. Yet the city doesn't directly weigh in on the wages or benefits of this workforce. The city certainly writes the contracts and funds the contracts to provide these services, and it has a lot to say about how those services are provided, but it doesn't specify the wages or the benefits that the workers will receive under that. Now, when it comes to sector parts of social services like childcare that are largely unionized, the city does take a direct role in helping to negotiate the collective bargaining agreement, or signing off on the collective bargaining agreement, and assuring that the budget dollars that are needed to fund that are in the city budget, and that the contracts include funds to fund that. So the city hasn't yet sort of stepped to the table and taken responsibility for this indirect workforce that's not unionized. Something about the demographics of this workforce. So using the available government surveys that we have access to, we estimate that there are 116,000 private sector social service workers, not including those that work primarily for healthcare organizations. As Jennifer noted, most of these are women of color. So 77% of all social service workers are people of color compared to 63% for the city workforce overall. Roughly half of resident workers in New York City are women. In social services, 82% are women. They tend to be slightly older in age and a little bit less well educated, but still 44% have at least a 2 or 4 year college degree. The earnings are quite low in this sector. According to the American Community Survey, median annual earnings are only a little bit over $25,000. Now, this is a figure that includes part-time workers, but most of the workers in this sector are full-time, so that figure is not weighed down by a lot of part-time workers in there. It's one of the lowest wage sectors in the city economy. It hasn't always been that way, but over the last 20 years, where there really hasn't been a focus on what the pay and benefit levels in this sector are, the compensation levels have slipped a lot over the years. That's not to say that New York City workers elsewhere in the economy have been doing well in recent years, but social service workers have been lagging behind even the average city worker, who has been lagging behind the growth in the economy and growth in productivity and incomes overall. Jennifer cited some of these figures from a different census survey on wages that a quarter of the workers in this sector make less than 10, 40% make less than $12 an hour, and 50%, half, make less than $14 an hour. But when we peel back the onion a little bit, we see that, in effect, there's really a two-tier wage structure here. When we look at wages by occupation and then look at the race and ethnic characteristics of workers in those occupations, we see that there's a big gap between white workers and workers of color. Median hourly wage for white workers is $18.19 an hour, 42% greater than the median wage for persons of color. Now, partly this is a function of the fact that white workers tend to be more concentrated in the higher paying occupations, persons of color more concentrated in lower paying, but there's no inherent reason why it should be that way. So if we had a better education and training system serving these workers, and something like a ladder of opportunity for people to progress from entry-level positions into better paying positions, we could change that picture. These low wages leave these workers, when they go home at night, in a situation where their family incomes are, in effect, not a lot better off than many of the clients they work with. So overall in the city, 24% of workers have family incomes below 200% of the federal poverty line. In social services, the figure is 34%. That's almost 50% greater when you look at it that way, from a quarter to a third. 30% of social service workers live in the poorest neighborhoods in the city, and another 35% live in moderate income neighborhoods that have median incomes in the $40,000 to $52,000 range. So they have incomes that are close to, and they live in neighborhoods, very much similar to the clients that they're serving. In looking at what existing wage standards there are in New York City, and separately we have a handout that provides a little more background on this, just so that people are familiar with these different categories of wage standards and the nomenclature here a little bit. So We have a minimum wage in New York State. The federal minimum wage is $7.25 an hour. Big debate about whether or not that should be raised to $10.10 an hour. 27 states now. 3 states yesterday voted for the first time to have a minimum wage higher than the federal minimum wage. And you know, these, if you look at these states, these are pretty red states. Arkansas, Nebraska, South Dakota voted for the first time to have a minimum wage. So when voters directly are asked about wage levels and what the minimum wage should be, there is broad and strong support for raising wage levels because everybody recognizes that $7.25 is just untenable in 2014 in this country. New York State has New York State is one of the 27 states with a higher minimum wage. It's now $8 an hour. It's going to $9 an hour at the end of next year. There's legislation pending in Albany to raise it to $10.10 and to allow local governments the authority to set a higher minimum wage, up to 30% above that. Some of us were very hopeful before yesterday that if the Democrats took control of the state Senate, that this legislation might pass. You know, it looks like that didn't happen, so that's going to be an uphill battle. The mayor is on record supporting both of those measures to raise the state minimum wage and to allow local authority. So New York City has living wage. It has 2 living wage laws, actually. Some of you might have seen that the mayor signed an executive order at the end of September expanding the coverage and the dollar level of the city living wage that applies to companies that receive economic development assistance from New York City. So the living wage in that case was raised from about $11.50 an hour to $13.13 an hour. The significance of that number is that's 30% higher than $10.10 an hour. The other living wage law in New York City, which applies to selected contract workers, but generally not social service workers, is at $10.50. I'm sorry, is it $11.50 an hour if health insurance is not provided, $10 an hour if health insurance is provided. That wage level hasn't been raised since 2006. And finally, there's a third category of wage standards called prevailing wages. This is what applies to the construction trades and to building service workers under state law. So we have some existing wage standards in New York, but we don't now have a wage standard that applies to this workforce, the social service workforce. So in thinking about what sort of benchmark might make sense in this area, you'll consider a couple of things. So look, the city's Center for Economic Opportunities says, you know, they have a different approach to measuring poverty than the existing federal approach. So they say a 4-person family, the poverty threshold in New York City in 2012 is about $31,000. The federal poverty level for a family of 4, which is uniform, you know, constant across the country, regardless of differences in cost of living, is about $23,000 or $24,000 a year. That's obviously inadequate in a New York City context where housing and certain other expenses are much higher than the norm around the country. There's also a standard, this is not a formal government standard, but sort of a research standard approach to thinking about what it takes a family to live, called the self-sufficiency standard. So this is a standard that the United Way and an organization called the Women's Center for Economic Advancement are very much involved in periodically updating this. We actually have a report, a new standard for 2014 that will be released at a breakfast on December the 2nd. So we'll make sure that all of you get that information. So that will basically update what it takes families of different sizes and compositions in different parts of the city to meet their basic budget needs. You know, what's it take for housing, for childcare, for clothing, for transportation and food and so on. This is really a no-frills budget. doesn't provide any savings, doesn't provide any vacation or holidays or even meals out. This is a bare bones self-sufficiency budget to what it takes to get by without recourse to public benefits like food stamps, Medicaid, housing assistance, and so on. And this level for a family of four, say in Queens, calls for a budget of about $70,000. Even for a single parent with a preschooler, $54,000. So, what would it take? What would a self-sufficiency wage be in relation to meeting a family's needs under the self-sufficiency budget? Even $15 an hour, doesn't allow one earner to provide for a family of four. But if you had two earners at $15 an hour, you'd roughly have a family income of $60,000 or so, which would get you closer to that self-sufficiency level. Let me turn it back to Jennifer to talk about what we see as the road ahead.
Very quickly. What we appreciating that $15 per hour is just a start, as James was saying. We're having preliminary conversations with the city, and they seem receptive to this. They seem receptive to the conversation. It's better to say it that way because they appreciate that there are many, many, many New Yorkers out there that are supporting other New Yorkers, and they're not faring well themselves. So we're recommending that we begin with a phased-in approach to a $15 per hour minimum wage, coupled with support for career ladder opportunities. One of the things that we want to avoid is giving people or helping people to earn $15 per hour and then having them be stuck there. So one of the things that we also are aiming to do as we move to put in place this $15 per hour is work with the city to figure out what does a career ladder opportunity actually look like in this field. The city's been doing some work already with the Jobs for New Yorkers Task Force, being concerned that people in all sectors, entry-level persons, move into a position and there they sit and they get stuck and they never are able to move out and move beyond. So we see this as an opportunity to work at it in the social service area, to take the lessons learned and even to apply them elsewhere. But we're not moving forward with one or the other. We think the two need to go in tandem. Next steps, what we're doing is developing a work plan with representation from the nonprofit community, and also, again, we want to partner with the city on this. We need to better understand the data on current compensation, human resource practices, what's actually happening in the nonprofits. We also need to understand what the ripple effect would be. If a nonprofit agency has certain staff that are on government contracts, but those that are not, what's the ripple effect and how do we address that? We need to understand what a career ladder actually would look like and what are the various supports that need to be in place for women who have children and maybe don't have family support, for people who work during the day, would need care at night to go to school, et cetera, et cetera. We need to better understand what the actual cost of implementation is in the short term and over the long term. And then finally, this is not something that is going to be piloted and just kind of a look-see, but rather something that we believe needs to be embedded in contracts. And so what are the contract provisions that need to be changed in order to effectively implement this? Our game plan with respect to our timeline is to complete this phase one, this clear plan for implementation, looking at everything from the data to what it would look like when it's rolled out, what the consequences are, et cetera, et cetera. We aim to have that completed by July 2015 so that we can begin moving in fiscal year 2016. And then the game plan would be for phase two to begin implementing the work that is rolled out in fiscal year 2016. We need to partner with as many persons as we possibly can. We see the city as a partner, but we need the funder world in place, even the private sector, to help us advance this, because this is a very important initiative. It concerns not just those that are the ones who would benefit, but it concerns communities that are vulnerable, because we think the impact would then inure to those communities as well. And ultimately, we just want to really stop the inequity that persists right now for people who are working full-time jobs, showing up to work, committing themselves, and yet they're struggling as well. We know the cost is likely not to be inconsequential, but we think that it's well worth the money. So that's where you come in.
I can,
Carol's going to give us the number and tell us how we're going to pay for it.
I can tell that Carol is chomping at the bit, but before she gets started, I just wanted to say that something that I should have said at the very top, which is that the title of our session is "Should Nonprofits Be Mandated to Pay Living Wages, and What is Philanthropy's Role?" There are some clear implications in the existing system for philanthropy, in the sense that funders are asked to pick up the slack for budgets that are inadequate from state contracts, and funders are often, for a variety of inadequacies in state contracts, are picking up slack. Maybe that would change somewhat if this initiative moved forward. I don't know, but there might be other implications. But the question is also that should be part of our discussion is, are philanthropic organizations feeding into the existing problem? So I don't want to lose track of that discussion. So we'll all be part of that going forward. I don't have something to say about that. So moving on to Carol, I want to say that before we move on to Carol, I also wanted to say that we'll have lots of Q&A in a little bit, but if there are clarifying questions, very focused clarifying questions about something very specific that Jennifer or James said just now that you want to ask about before we move to Carol, speak up, but otherwise we'll move on to Carol. Yes, Brian.
James, in terms of the difference by people of color, how much of that is as opposed to someone who's a social worker who has a degree, I assume has a much higher wage,
Right.
And then sort of those without a degree have a much lower level wage. How much of the difference is explained by that?
Just by the difference in occupation. We haven't put our finger on that yet, right? So what we're focusing on is the need to make sure that there are opportunities for the people at the entry level to move up. We've looked at these numbers over time. We did a similar analysis in 2002 and saw something very similar and compared that to other sectors where you see a similar demographic composition, and yet because take the healthcare sector, for example, similar demographics, but you find sort of a more fluid wage continuum and not such a two-tier structure, because there are systems in place to help workers get more education in advance.
Right. And I would
If people of color who are social workers, are they being paid a lower wage than white social workers? Because you got apples and oranges in terms of job candidates, in terms of that.
Right, yeah, we haven't done that work yet. I mean, we do know that there are disparities in pay in this nation still based on race lines. The other thing is that I think, we haven't yet done all of the work, but we'll likely also see differences in pay depending upon the size of the organization. Larger nonprofits often have greater resources to subsidize salaries.
Great, thanks. So we're going to move on to Carol Kellerman of the Citizens Budget Commission. For those of you out in the online world out there, Carol is an amazing resource and very thoughtful person on these topics, knows them really well, and has been immersed in these issues for decades. So I'm so thrilled that she's here. Before we move on to her, I just want to add that a lot of you were mentioned, and James mentioned in the news over the past 24 hours that a lot of minimum wage laws around the country, ballot initiatives were successful. One of my favorite headlines from this morning was something to the effect of, yes, very popular minimum wage, but so were the representatives who vote against them. So there's a lot of disconnect in the American public, and I don't think New York is any different about, yes, minimum wages, but not being really clear about the path that you must go to get to those minimum wages. So, Carol.
Well, I think I was asked here to be the skunk at the garden party who expresses the concerns and drawbacks, and I'm happy to do that. But before I do it, I think, I know you all have my bio, but I also, people don't read that. And I think that it's important for you to understand where I come from and the perspective that I have on this. So I want to emphasize that I have been the director of nonprofit organizations that deliver social services in New York City and receive their money through city contracts. I have also been a member of this organization as a grant maker, and I've worked with many of the organizations that are represented here in collaborating on grants when I ran the September 11th Fund. I was also the Deputy Commissioner of Finance for New York City, responsible for generating the revenue. So I see these issues from a number of different perspectives. I joined the Citizens Budget Commission, which is a fiscal watchdog, because I do think of myself as part of the nonprofit and social service delivery sector. And I think that what government does to support the social safety net is extremely important. And I think, as Mayor de Blasio often says, that you can't be effective in delivering services through the government if you aren't taking care to husband your resources carefully. And so that is why I do what I do, is because I do believe in government and I believe in the nonprofit sector in New York. And I see my role as articulating sometimes inconvenient truths that are necessary to accept if we all want to move forward. Okay? I'm not from an no tax, cut government point of view at all. And listening, as and I'd also seen the PowerPoint before from James and Jennifer, who could disagree? Of course, paying social service providers more is an important and worthy objective. They are unsung heroes. And according to our data, we use the same community survey from the census as James. There are about 35,000 of the 100,000 plus social service workers in the various categories in New York, leaving out healthcare, that are earning less than $15 an hour. I do want to say, though, that it's important to remember that there are also many people in the nonprofit sector who are not making sub 15-hour wages. I think we came up with an average for the nonprofit sector of $55,000. There are clearly many people, more in the people who are above $15 an hour. But most are making far less than that. And from the perspective of Citizens Budget Commission that specifically watches the city and the state budget, most people in the nonprofit sector are making a lot less than the average public employee. A fireman, a policeman, the average cost of compensation for a New York City employee is over $100,000. And they have much better not only salaries, but also fringe benefits than workers in nonprofit organizations. So who could object? And all of the data that James went through is very compelling in terms of the need and the value of paying the frontline workers a better wage. But the question is, how much does it cost, and where is the money going to come from? And is this something that Philanthropy New York should be in the forefront about? So they end their presentation with the costs aren't inconsequential. Well, that to me is really a key question. And I agree that we don't know. And you can't really be for this, I don't think, until you have some sense of what it's actually going to cost. And we need a lot more information from the service providers to do that. We tried to do a very quick analysis. It's very ballpark, but just to give an idea of what are we talking about here. Okay, so using that data and the 35,000 people and trying to estimate what the gap between what those people make now and $15 an hour, we came up with the fact that, and you have to, with or without fringes, and what do you attribute the fringes to, and a lot of them are part-time, but basically it's somewhere between $250 and $400 million a year. And James and I can talk about how we did it later. And, you know, I certainly agree that whoever is advocating for this proposal should go further in trying to actually get a more precise number. But it is a not inconsiderable amount of money. And you're telling the nonprofit community that they have to come up with this money every year going forward. And, you know, then cost of living, whatever else goes on top of it. So it's a big amount of money, and that's just what we calculated for the $15 an hour. That doesn't include the cost of the career ladder program, which obviously will also involve expenses for the training, for developing curriculum, for putting people on these career ladders and paying them more. I have no, you know, it's going to be very hard to estimate the cost of that, but that's, again, another expense for nonprofits that would be created by requiring these things in their contracts. And as Jennifer said, there are also going to be a lot of other effects. Is it just for the contract employees? We're kind of estimating that out of the 100,000, 113, whatever, in this industry in New York, 60% of them are probably paid for through contracts. So there's another group that's not even included in my estimate. Can you pay them separate amounts? Probably not. What about the people that are making $16 or $17 an hour? Now, if 15 becomes the floor, don't you need to give them raises so that they are appropriately compensated more than the people at the entry level? So there are a lot of other effects that which are not, we can't even anticipate them all, but we can anticipate that they will drive up the cost more than the kind of the preliminary, just pay people the difference between 12 and 15 type of estimate that we came up with. So, you know, it's easy to tell other people they should do this, but is Philanthropy New York going to say that its members are willing to contribute to the costs? As one of your prior members and as someone who has written grant applications, your organizations like to fund their specific project, their pet project, some people would say, or their important strategic initiative, other people would say, but they don't like to just spend money on salaries. They want things to go directly to the clients. And I would be very hesitant to start making proposals about other people's money, unless all the board members of the Philanthropy New York organizations are all willing to chip in, in terms of grants or in terms of additional tax dollars. So I think that's an issue for people in the philanthropy world. I also think that the philanthropy world should think about letting the nonprofit community take the lead on things like this and not be directing them as to what they think should be done. I have spoken to many nonprofit executive directors who, they may not say it publicly, but maybe they will if this moves along. Really, this is not what they would make their highest priority. The nonprofit community has not gotten a cost of living increase on their city contracts or their state contracts in years, which Jennifer and James correctly present. I think many nonprofit executives would feel that if they got an increase, they have a lot of other priorities in addition to raising a particular group of employees' salaries that they need and that have built up over time, and that they would prefer to be given the discretion to make administrative decisions about salaries and about how to allocate much needed refunding and increases in funding, and not simply be told that this is what it has to be spent on. And the thing that really also concerns me when you give the correct history about how things have been cut. Things were cut after the September 11th, things were cut after the recession. It is definitely true that when the going gets tough, social services is one of the first targets for cuts. I agree with that, because it doesn't have an organized constituency the way other aspects of city funding and state funding do. Now, you're presenting that as a therefore we must have this. I'm presenting the other side, which is, what's to say that won't happen again? That's a real concern for nonprofits, that the city impose a requirement on them, and even if this administration says that it will fund it, first of all, it's not clear that that can happen. You know, there are a lot of priorities that the administration is adding on every day, new initiatives, and we'll have to see whether there's enough revenue for all of these things. But if you put in an obligation in nonprofit contracts that they must pay for certain things, and then things don't go so well, something happens in the economy, or other priorities come along and the city cuts the funding, the nonprofits are left there holding the bag and having to pay for these things. And I think that that's part of the reason why some nonprofit executives are concerned about this, that the story of how we got here and how starved for funding they are is not that infrequent and will happen again. And they have to be prepared for that and not have requirements put on them that they all would agree with and would like to do if they have enough money to do everything else that they need as well. So those are my drawbacks and concerns.
Thank you. Before we move on to Allison, I have a quick clarifying question. So 250 to 400 million per year, possibly it could be. Put that in the context of the overall city budget, one. And then two, could you say something about city versus state and that relationship of the funding from what's coming from the city and what's coming from state? And what
Okay, the city budget is about $72 billion a year. As James said, the contracts, the social service contracts are around $5 billion. My estimate from looking at kind of a breakdown of city social service contracts is that the personal service part of the contract is, I have 1.7 billion. Okay, so you're talking about adding on, say it's 300 million. So you could say, well, that's a rounding error in the city budget, but everybody has a $500 million project that they want.
That's how much city council puts into the budget.
Yeah, I mean, it's a lot of money. There was one more thing I wanted to say that I didn't look at my second page of my notes and see. The concern that that nonprofits will be given what we call an unfunded mandate, something that they have to do, but that there's not a guarantee of the money to pay. The other thing is, again, James and Jennifer presented the fact that the city has 300,000 employees, and they haven't ever told nonprofits anything about requiring their salaries, but that in effect these employers are providing city services. I think, you know, I was involved when Nick Scapetta changed the orientation of the foster care system and child welfare in New York to be a community-based, nonprofit-driven social service. And that's true of all our social services, mostly. They're done through the nonprofit community for very good reasons, because the community, you're closer to the community, and you can do these things with more care and more understanding and sensitivity, and I think that's very important. And I don't think that we should be taking steps towards making nonprofit employees de facto city employees. First of all, it's not going to happen. The city can't absorb 100,000 or even 50,000 more employees at the level of compensation and benefits that those employees get. And I think it would be a mistake to try to go in that direction. I think the fact that we have a decentralized community-based system is one of the strengths of the social service system in New York City. And we should want to preserve it and keep it that way.
Thank you. You've given us a lot to think about.
A lot to think about.
Yes. Allison. Hi. Allison
Hi.
Sesso from the Human Services Council of New York City. One of my favorite people in the world.
Yes, so we are the the voice of the human services sector, who Carol pointed out should really be central to this discussion. I obviously agree. So just to give you guys a background quickly on who the Human Services Council is and whose voice I'm sort of collectively bringing to this discussion. We are a membership association, much like Philanthropy New York, of the providers of social services in New York City. So we're not all nonprofits, we're specifically human services. And we are primarily those organizations that are receiving the bulk of their funding from the government through contracts. This is obviously a generalization, but in general, most of my members receive something like 80% of their dollars from government and more like 20% from philanthropy. Some are more, even more, more like 90, 95%, and some are half and half, but in general, it's a lot more government funding. And they really do represent the majority of the nonprofits that are receiving that $5 billion that the city spends, and the state, I might add, spends another like $7 billion on social services. So there's a lot of money in this state and city that's going into social services. It's a significant sector. I do think that part of the problem in general that we run into for this sector is a misunderstanding of how it's run by the general public, by people who work with it. There is this sort of big myth that nonprofits are primarily funded with philanthropic dollars and run on volunteers, and that is absolutely not true. It is a real industry in the city and state, and we need to get there where people better understand that. And then I think these conversations may take a different turn and may make more sense even in the political context. So I agree with both perspectives to some degree. I just think that this is a lot more nuanced, and it's just not easy. It's a complicated issue, and I think we need to walk into it very, very thoughtfully. And I think that I know that I've had conversations with both of everybody at this table about this topic, and I think everybody's aware of that this can't just be something that we flippantly decide to do and force onto the nonprofit sector. There is no question that the human services leaders throughout the city struggle to pay their employees a decent wage. And as a result of that, there is a lot of turnover, which is extremely costly. It hurts the quality of the services we're able to provide. And our ability to compete with other sectors is more and more diminished every day. There has not been cost of living adjustments given to the nonprofit sectors since 2008 from the city or the state, and that's really problematic because it means no raises. But look, each nonprofit is an individual entity. I mean, that's the beauty and also the tragedy of the nonprofit sector because of the fact that they do receive most of their dollars from government. So how they've managed through these fiscal times is different. Each nonprofit has made different decisions about what they've cut, or some of them have cut programs to survive in this flat funding environment. Some have reduced benefits to their employees. Others have reduced staff salaries. Others have reduced the staff overall. I mean, it all depends. Some have used parts of their endowment. I mean, everyone has a different situation. Everyone looks at their budget and makes different decisions. So we do want to do something about the wage situation, and we want to increase the basic wage. Carol points out, responding to James about the city employees being de facto, the nonprofit workers being de facto city employees, and I agree. I don't think that we want that, but at the same time, we need to make sure that they're making a wage that's at least competitive with the city employees, right? And that's not happening right now at all. And so that's a huge problem. So we want to get it to that point. And unfortunately, we are more and more, I'm getting these calls from my members asking me logistically and legal questions about whether or not it's appropriate for them to refer their own staff to the services that they provide. And it's disgusting. It's really, really a problem. And that's where I have to focus my efforts. It's not okay. So we really have a real problem here. The nonprofit budgets really just aren't in a good place. But I would say that we can't really separate the personnel services side of the budget from the other than personnel services side of the budget so easily. And we can't just focus on one end of the ledger. The cost of doing business have changed for every business in the state and city and nation over the last several years. Cost of health insurance have skyrocketed. I think that's the biggest complaint that I hear. And you know, nonprofits are nonprofit, meaning that there's not a place, they can't dip into a profit margin or change the price of what they're selling or providing in order to make up for those higher costs. So they have to make basically not great decisions about how they're going to save those dollars and keep things running. And so what ends up happening is they make poor, you know, I wouldn't say poor decisions, they're the best decisions they can make. But if government doesn't come forward and make up, you know, give them those cost escalations, I'll prefer that language, cost escalations, because it provides that flexibility that Carol's talking about so much to the nonprofits in terms of letting them manage their way through this. I think that we do need to look at both sides of the budget with the goal, I think, of at the end of the day, thinking about what the impact is on the workers. There is no question that the nonprofit management knows that they need to, that their ability to provide quality services rests with their workforce. They know that, but they can't seem to meet these goals. And I think anything that forces them to do that will just make them have to make harder decisions that really won't end up being the best decisions for their workforce. And I would say some of the complications in doing this in terms of even if New York City wants to do this and wants to put the money in the budgets. And I think we would work with them and figure out how to do that in a way that's meaningful. But you have to think about the other funding sources, including philanthropy. I absolutely think philanthropy would need to be part of this discussion. The state, federal dollars, all of that needs to be considered. And not only the direct contracts that come from federal and state, but New York City is going to look at this and say, well, we get a lot of social services dollars, our funding streams that come into the city from the feds and the state. Are they going to increase their amount that they're willing to give us for those programs to cover these costs as well? So we have to think about those other aspects. I agree with what Carol said in terms of other employees. This is what I've heard from my members. The other employees that are just above that wage level, if we were to increase it, are definitely going to be looking at the people below them and saying, wait a minute, my skill level is higher and I'm only making this, the differential, you just close that gap. Where is my raise? So we have to consider that. And the nonprofit managers are concerned about that. And they're also concerned about the idea that if only the increase comes in on city contracts, would they have a two-level workforce? You know, the state people on state contracts don't get that level. So these are sort of the things that, again, they're real complications, but they don't mean we can't do this. I want to be clear that I think we can think through how to do this, but the flexibility factor here is what we're talking about. We have to trust the nonprofit managers. If we trust them with all the amounts of city dollars that we trust them with and to manage that, we have to be able to give them the flexibility to manage through how to implement this for their organization. I understand that the city and the state and government and all funders want accountability, and they can get that accountability, but they have to trust the management of the nonprofits that they're contracting with and giving dollars to at the end of the day and let them manage through this. And they have to be willing, frankly, to let them pay for things that aren't so sexy. I mean, they need to let them pay for health insurance costs, for the higher rents. I mean, you know, I don't want to get into all of the issues that are going on here, but nonprofits are selling off buildings and properties because they're trying to make ends meet because they've been operating in a flat funding environment for so long. I just would want to point out also just as a I wouldn't say cautionary tale, but an example here is the paid sick leave impact. That was a good thing. We were supportive. HSC got behind it. We agreed with it because it's the right thing for workers throughout the city, and it's the right thing to do. But just to give you an example from one of my member agencies of what the cost was, you know, the first thing they told me, it's a great benefit to our staff, but it's an unfunded mandate. And direct care staff, they said, had to be replaced and paid a full day work. It cost them $350,000. And that's a lot of money. I mean, that's to come out of where are they going to come up with that, right? So that's just like one example. It costs money to change change policies, and I think that we need to be thinking about that. So I would just say overall, HSC absolutely agrees with this idea of raising the wage of the lowest paid workers. We want to be at the table and make sure that we think through very thoughtfully and carefully about how this would actually be implemented, because there are a lot of nuances to it, and the flexibility that have to be given to the managers is absolutely critical.
I'm over here chomping at the bit.
I'm going to give it over to you in just one moment,
Let's
but
do
I
that.
want to just say that, in the preparatory discussion for this, we talked a lot about the paucity of really good numbers. You would think in this area of hard things like salary, benefits, and contracts that there would be good numbers about the implications of doing various things. However, when you're talking about the fact that, this huge segment of the workforce is itself part, is a major recipient of the services that they provide because they are low-paid workers, so they actually get these services. And if you paid them decent wages, would they no longer have to rely on services so much? So that affects the budget figures, and it's all very complicated and confusing. And there's so many variables that it's really hard to get a good sense of the numbers. So I would just put out there that I would love for some big-pocketed foundation to spend money on a really great fiscal analysis of the implications. Just put that out there.
That's on our agenda for, before we finalize a proposal to the city, we need to do that.
Mm-hmm.
Jennifer.
That's a great request, though.
I'm sure for
So,
you. Sorry.
I'll begin by saying that the lawyer in me is desirous of a very full-on debate about this, and I think that I came in here thinking this would be a conversation, so I'm going to try to keep it at a conversation. I don't envy you. I don't envy your role. It's an important role that you play. But if we did all of our decision making, beginning with the premise that everything has to work within a certain box, we really wouldn't get ahead in this country. And the fact that we've got several thousand people here in New York City who are putting in a full day's work, working as hard as they can, and we want to just kind of stay in the box because we're concerned about what would happen if we opened up the box. That doesn't work for me, and I'd like to think it doesn't work for many other New Yorkers. You talked about, there were some assumptions that you threw out there that really, they're just assumptions. We're not talking about this being an unfunded mandate. We're talking about the government making a solid investment and committing to working with us on this. We talked about, we didn't say that we would make the city, these agencies city staff, but just as we saw with the expansion of full-day universal pre-kindergarten, people appreciated that it's not right for a person with the same credentials to be working in a CBO and making $20,000 less than a government employee doing the same job. And so we need to look at parity, we need to look at equity, and we do not need to be stifled or hold back simply because at this particular point we can't figure out where the 250 or the 400 comes from. What we've been talking about is working together. We went to the HSC, we had a conversation with a very broad and diverse body of nonprofit leaders reflective of the nonprofit community. And many of the concerns that have been articulated were concerns that we share there. Frankly, they're concerns that we all hold. We're not jumping in, being naive about this. And what we heard was, conceptually, we agree this is something that needs to be done. There are a boatload of issues, a plethora of issues that need to be looked at to make sure that we control for the consequences we intend and the consequences we do not intend. But we're not going to let, the perfect be the enemy of the good and not jump forward and try to figure this out. We have a responsibility. We have a responsibility to be be fiscally prudent, but we also have a responsibility to ensure that people who are working every day are not hemmed up. And a COLA is a good thing, but a COLA is not going to cut it when a COLA is on top of a wage that to begin with doesn't help people meet their basic needs and supports. So I appreciate what you're saying, but it would be a travesty for us to walk out of this room and say, just because it doesn't fit at this particular point, like, we can't button it up and make it work just the way that we want it to, that we don't stop thinking critically about this and advance this work. That's my personal opinion.
Well, I wholeheartedly agree to that. If I could just
and then we're going to turn over the question.
add a couple of things. So keep in mind, as we all know, this is a very fragmented sector. 5,200 contracts, lots of organizations, over 100,000 workers. It's a sector that has been beaten back and beaten down over the years. Always asked to provide more, but do it with less. That's not the only part of New York City that happens in, but the city government, our government, has been doing this to these nonprofits who are providing essential public services on behalf of the city. No one ever said that we should make these workers public sector workers. But the wage structure that currently exists is just untenable. This sector has not, over the years, figured out how to address that. So here's what we're looking at is, an opportunity with a great leader in City Hall who understands these issues, understands the shortcomings in city approaches in the past, and is open to addressing this. So we say, okay, let's move on this and try and address this. So it's a lot to figure out. There are lots of moving parts. I couldn't underscore more what Jennifer said about, not letting the perfect be the enemy of the good. We're mindful of the fact that, we need to have a parallel campaign at the state effort. We're thinking about that. That's stage 2, but that shouldn't hold us back from moving forward as quickly as possible with getting the city on board in this. If you think about how change happens in this country, that's how it happens, one step at a time. It's not, it's like you're looking for a solution to peace in the Middle East, and nothing good is going to happen until we have peace in the Middle East. So in the meantime, we're going to keep killing each other over this. So, our understanding of change is that here's an opportunity. We've defined a problem. There's interest. We're working with the city. We have lots of issues to address, lots of things to figure out. That's why we're here, to help sort of, talk to you about this and get your interest in working with us on this. And don't forget that this is not, we're not talking about just, imposing a new wage standard here. We're talking about providing a new set of opportunities here, which is what the mayor is all about. He's not about redistributing income. He's about helping people earn their own way. So we're talking about raising wage levels, but also putting in place a system where people who are interested in pursuing advancement have the opportunities to do that. They should be rewarded for that. And this is a sector that has underinvested in professional development and hasn't had the wherewithal to reward people. So who can be against, trying to address that?
Okay, I just want to. I didn't talk about the career ladder part at all, and I just want to point out that that's one of the decisions that a lot of the nonprofits have made. That's a discretionary funding stream for them, so they have cut anything in terms of investing in their staff. So we very much do need to look at that and look at career ladders for them, because they used to do that for their staff, but it was one of the first things cut because that's a discretionary fund, and in flat funding environment that goes.
Michael Haberman.
Hi. So in the spirit of it not being a debate, I actually would say that I don't see your position and Carol's position at all at odds with each other. I think you can say this is something very worth doing and all the reasons to do it, but it is really hard to go beyond that without understanding what the cost is and how it's going to be paid for. And so, and I would agree with Carol that I don't think, both having run a nonprofit and now being a funder, that most nonprofits want to commit to the long term to saying a portion of our budget is now just going to an increase in salary. But I think that, if government's going to step in and say we're going to increase, then, so I don't see those two things as mutually exclusive. Another point I wanted to make, I think that part of what we're getting at here is an issue that I've thought a lot about, and maybe this plays into the campaign or whatever it is, but I think even outside of social services, for some reason, we just don't value the work that nonprofit people do to the extent that we value what other people do. So whether they're government funded,
Value the work that nonprofit people do, and we don't, the work that they do, and very often we don't value them, the workers themselves.
well, right, because we expect them to do a lot of very hard work for much less compensation, right? So I think that that's a broader issue that's, you know, until we figure sort of that issue, it's always going to be a struggle to see how you get people compensated well. But then my question is, have the number of nonprofits out there getting city contracts, to me, was pretty startling. And I think, James, you even alluded to the fact that, someone alluded to the fact that some of the larger ones have more capacity. In this analysis, will you look at all, would we have more money to spend, and would we be able to increase salaries of workers if there was a consolidation of nonprofits to some extent? You know, what would be the savings in that kind of approach?
So you probably know some of this is when the city has been working under the Bloomberg administration. There was a lot more consolidation and a lot more, many more contracts going to larger nonprofits. And as a result, there are a lot of small CBOs that have been cut out of the game. And interestingly, you see the impact of that when you have occurrences like Sandy. When Sandy occurred, there weren't a lot of small CBOs on the ground to provide critical support. And the city struggled in those first weeks and months trying to figure out how to get help to the communities where they needed it, because the larger, I'm sorry.
Those areas impacted by Sandy had never had CBOs.
No, but there were smaller CBOs that used to be there. I know that for a fact because I worked in child welfare and child care. And there were some small CBOs that were on the ground that when we started trying to reach out to people, they were no longer there. It was a problem. In talking with, and I was with the city at the time, in talking with John Ray from NYCHA, he turned to CBOs that were no longer there. And so there has been a problem where we did have more under the Bloomberg administration. The more competitive agencies were the larger agencies, and they got.
I think my point's a different one. Is that I think if you look at the development of social service organization, it's geographically very uneven, and it hasn't kept pace with it. And so the recession knocked a lot of organizations out. So when Sandy came, Staten Island, Far Rockaway, sort of other areas, just had no groups to do that. So they had to. So funders had to sort of ship groups in order to do the work. The city had to do that. So I think it's a different issue, you know, in terms of how there's more even capacity in, you know, parts of Queens, parts of Brooklyn, even parts of Staten Island.
Small, it's hard to get up and going, and if the city's not giving you a contract, it's hard to get going.
So let me, were you only talking also about, were you also talking about on the nonprofit side consolidation? See, so this comes up a lot. Everyone should just merge and everything will be rosy and beautiful, and that's just not. Look, the nonprofit sector, this conversation is going on like crazy, you know, and a lot of nonprofits want to merge. I know one, I won't name the actual nonprofit, but they're a large nonprofit. They're well run. They've been around for a long time. You know, for every 2 nonprofits that they've merged with, they've had probably 4 approach them, but their budgets don't look good, and this is the problem. Across the board, the nonprofit sector, the ends are not meeting because the amount that they're getting paid for the work is not adding up to the cost of the, and there's only so much you can do to manage around that problem. You know, I mean, we're mirroring our clients.
Well, and add to that, very often when they do merge, then the people who are working in those agencies that are on the ground begin not to look and reflect the community itself, and then that raises another set of issues.
Given the size of the undertaking, have you thought of if you started with one of these funding streams or one of these positions, how you could prove that it could be done? Because you know, no one disagrees that it shouldn't be done, but you sort of have to change the strategy and sort of change the job titles and do all that sort of thing. Is there a sort of an area that of the top 4 that you identified that has more potential than others to start to do, and so you could then have a model for how it could be done?
Yeah, yeah.
Kind of hard to do that, you know? Pick one type of service and you know, to drive people into away from what they're doing.
Public administration, workforce, where they basically made the assumption that there's only placement activities been going on with $500 million, and that they should now move to a training system. If you move to a training system, it means you serve fewer people, but you serve them a whole lot better and you get better results. So it's sort of changing the values, which private funders have been doing all along, and now the city is looking to do that sort of thing.
Yeah.
So at that time, sort of getting at sort of how you sort of start creating a career ladder.
Oh,
Career ladder is doable, but not the living wage floor.
I'm sorry, I was responding to the wage
Yeah.
floor, but the career ladder,
The
sure,
workforce
you could.
system, I think basically, most people, most job functions get paid a living wage. The job developers are in the 30s.
Yes.
That's
So,
That's true.
but if you're going to start doing skills training, you probably need to even
Yeah,
higher level.
In the career ladder, you can
I'm
do
just
it.
using it as an
Yeah,
example.
no, that you could do.
So, I guess we see an administration that is bold, to come in and do UPK in the first year was very ambitious. But the mayor makes no apologies for that. He said the other day, this administration doesn't do pilot projects. And also sensing that, this is a moment to do something like this, in an area where there's been no progress, there's been regression for a long time. If here's an opportunity and an openness to address a big problem, and get a lot of hands on deck to address that, if he's willing to do that, we're willing to do that.
So I'm going to forget the cautions for a moment and stay in the blue sky area and ask if there's a sort of a third tier that if we want to help people break out of poverty, are there other supports that we can put into place around banking or career counseling or helping people low-wage workers find childcare, that if there's any evidence around any of that that we could be thinking about at the same time?
Yeah. Well, so there are things that we've been talking about as part of this to help this workforce. One of the things we're looking at in terms of how you do a career ladder is one approach would be an education and training fund that would be sector-wide, that the city would fund, and that Philanthropy hopefully would contribute in some way toward, that would provide things like childcare supports to enable workers to go to school or access training programs or education programs at night, and so on. And I know separately the administration is looking at a lot of things in terms of how to address poverty, and there appears to be very significant change going on in the welfare reform area right now. So
frankly, what it sounds like you're suggesting is what's already there, which is that people who are being paid substandard wages need to rely on the social service system that they're working for, which is kind of a password. So, I think that's what we want to get away from. But Rana.
So this program ends at 5?
Yes. It does.
Okay, so I had 3 questions. I'm going down to 1. That's the first thing. And I'm going to ask one that's short because I suspect each of you want to make a final comment. So it seems to me this is a really hard, thorny issue. We've all said that. If I was in the position where I had to make a decision and say, look, this is too complicated in terms of the wages, I would leap on the career ladder as saying, this is going to be so much easier, less costly, I can control it more, as another way of addressing part of this problem, since you can't address the whole problem. Are you concerned about tying these two things together and basically giving, to some degree, an administration who is there in terms of their philosophy, but may not be able to be there in terms of what they can pull off, that you're basically giving them an out in terms of the contract wage by saying the career ladder is, tied to it, when they could pull that one out. Is that clear?
I get the question.
Should we have someone from the administration?
Oh, would you like, I did not mean to put the administration on the spot.
Allison, and I work in the social services field prior to coming to the administration as well. I think candidly, the response is, nothing's off the table, and we're talking. I do think part of the challenge is the data. Carol, you've been in the city side, and it seems like a simple thing to say, like knowing how many providers you have, what are the job titles, what do they make across the entire city. Again, it sounds like an obvious thing, but it's not that easy, and so we're trying to look at that because when even the number you talk about, the 250 to 400. You could say some of it is, let's say, going to be with the unions negotiated. That's a piece of it. And then if you're meaning like it's not all ununionized workforce, right? Some of it is going to be in labor negotiations. Some of it's going to fall outside of that. So I think there's also subpopulations when you start talking about this. But I think at this stage, it's we're trying to have the conversation. We're talking to as many people. That's why I'm here as well, to kind of delve deeper into the issue as well. But at this stage, I'd say, nothing's off the table. That doesn't mean things don't change, right? And I think the challenge is where, as an administration, there's definitely, we all know in the social services, it's critical to the kind of the livelihood, the character of the city, and these workers are the crux of it. Most of it are the provider staff. The vibrancy of neighborhoods are a lot of these smaller CBOs. It's not all about the larger ones as well. And how do you build that infrastructure in a way that is sustainable as well? And so I was here to listen, but I thought I'd just comment that it's at least at this stage, we're talking and we're listening and we're trying to learn. And again, it is. And it sounds silly, but it's just difficult to just fully size it because you can make certain assumptions, and this number, even like 250 to 400, right, that's a pretty big swing. Yeah. And I'm sure if you made different assumptions, we could come up with a different range, right, higher or lower. But I think part of it is how do you do this in a sustainable way, and I think that's a fair concern.
I think that what we're going to do is give Rachel the last question, and then we're going to just have last words from all of our panelists.
So, in the spirit of the way you started, I think we have a grand idea that's based on a real need that is really important as a messaging and campaign thing to put out there and to fight for. It may take a long time to get to perfect. So there's no doubt that moving the legitimacy of the idea, of the end goal, is important. But we also know there's a lot of difficulties in working it out. And I'm also influenced, because also having been in non-philanthropy management of nonprofits for many, many years, with your point about the sort of flexibility, the need to give people an ability to figure out what they need to do. And so I imagine this idea that the city comes up with some algorithm for bumping up proportionate to contract sizes and workloads and whatevers. There's some bump. And what contractors are told is, with this bump, we want you to figure out a way to do something that advances the wherewithal of your lowest paid workers. It might be benefits, it might be salary, it might be I don't know what, it might be loans or staff development. You figure out a creative way that works for your organization to take this bump and make it a meaningful contribution to your low-wage workers and their sustainability and future. And you do that for a year or 2 years, and you learn a lot about the kinds of things that people come up with and the degree to which they may be transferable from one agency to another, one sector to another. Maybe they're not, maybe they are. But you let a little bit of Thousand Flowers bloom on how you deal with the complexities under the broad idea, which nevertheless is an important idea to normalize, to make it part of the norm, the fabric of something we believe in.
All right, that's a very interesting thought. So I am going to start off with James and just go down the line on final words on our day. James.
So I guess I would just connect this to the broader interest around the country out of a recognition that wages are just abysmally low for too many workers. Something should be done about it and something can be done about it. You know, witness this 80% support for raising the state minimum wage in, you know, very conservative states. So we all recognize the need to adjust wages. Here is, you know, just to reiterate that, you know, here's a sector that's providing an essential public service in New York City to a vulnerable population where the wages have been beaten down over the years because the city has never paid attention to this. Here's an opportunity to address that in a meaningful, sustainable way. We should seize the opportunity.
You're here. You're good.
Yeah, well, I mean, I agree with Jennifer, it's not a debate, so I don't want to, you know, I think I agree with, my job was to give you the downsides. I think that what somebody here said, it's, you know, theory is great. I'm concerned about implementation and about making it sustainable.
Yeah.
And we're all concerned about that. And I'm also concerned about, from the point of view of this entity here, taking the lead from your grantees and having them, I'm glad to hear that you've all been just talking, but having them be the leaders of the sector on this conversation, because they are doing it. And they agree with the need for the employees to be paid more, but, you know, I would defer to their judgment about how to go about doing it.
Yeah, I would say, I mean, clearly we're supportive of this and we want to be in the middle of this conversation to make sure that it's implemented well. And what we found is, in general, any public policies that really impact the nonprofit sector, human services sector, especially when it involves the city and policy changes, when we're in the middle of it and we help guide where we end up, this policy ends up working a lot better. I mean, the accelerator system, which is the contracting system, is a perfect example of that. We took years for us to actually get that completed, but it worked well because they kept coming up with ideas, and then they put the actual ideas in front of a panel of nonprofit providers and let us give feedback, and then go back and make changes and bring it back again. That's the process that we need to work together on. And I would say, just going to your comments, you have great ending comments, and I think that going back to the idea of doing an analysis of the sector, doing that is even more important now before we do this change. So this is something we should think about when we do an analysis of the sector. If we're going to potentially make this change, let's see how the sector is in terms of its workforce and how we're paying people now. See if we implement this change, how it changes.
Sure.
That would be hugely important.
That's the plan.
Right,
That's the plan,
exactly.
to do that.
Well, I would just like to say that, you know, obviously with the idea of nonprofits, as we framed it in the title, being mandated to pay living wages, there is an idea of a moral imperative. And with any moral imperative, there's a clear idea that something should be a certain way, and some very imperfect and human aspects of making that actually happen, that we're subject to all kinds of bumps and messes along the way. And I just want to say thank you so much, James, Jennifer, Carol, and Allison. Thank you so much for helping us think through this and giving me an hour and a half of amazing thoughts to jump off of as we move forward. Thank you.
I wonder what our live streaming audience was. I wonder how many people were out there watching.
Request or whatever.
Oh,
And if
yeah,
they, will they have a tape of it?
I just put that out there to try to make this public. Same kind of thing. But I want to come up with a in at the same kind of element. So we create like an immersion.
Oh.
The nonprofit sector